Medical advances in women's health is always changing. Earlier in the show, we introduced you to Dr. Greg Marchand. He's a board-certified OBGYN, and he's known for his expertise in minimally invasive surgery when it comes to women's health, and he's got you covered. So what is new, or what is the latest in minimally invasive surgery? What are you working on right now?
Well, my latest publications have focused on an ultra minimally invasive risk-reducing salpingectomy.
What is that? Okay, say that again. What is that?
Ultra minimally invasive risk-reducing salpingectomy. So basically what that means is we've taken a new spin on the old-fashioned procedure of just tube tying.
Okay.
So with this new procedure, through minimally invasive means and having essentially no scars, we're able to do an outpatient procedure that both gets the woman the sterilization that they're looking for, as well as a lifetime reduction in ovarian cancer.
Wow, that is huge for women. You know, you remember back in the tubulars back in the day, so this has come such a long way.
Absolutely. It can also be combined with a surgery such as an endometrial ablation or a stop the flow procedure if the woman also suffers from undesirable periods.
All right, so let's talk a little bit. I've been reviewing your various medical distinctions. You hold a Guinness World Record and a Center of Excellence Award. How did you earn these distinctions?
Well, I was part of the team a few years back that set a Guinness World Record by removing the largest uterus ever laparoscopically.
Wow.
We actually removed a 7-pound uterus using just tiny incisions without having to cut the woman open.
7 pounds? How was that being on a team like that?
That was quite an achievement.
I can imagine. Well, congratulations on that. And I have heard of the Center of Excellence Award before. I know it's been awarded to some pretty prestigious hospitals, Kaiser, the University of Pennsylvania. Is this the same?
It's the same program. I've also been awarded that COMIG Award, or Center of Excellence in Minimally Invasive Gynecology, in conjunction with other hospitals I've worked with, the same award that Kaiser and UPenn have received from AAGL. But this is the first time they've ever given a distinction to an individual surgeon.
Okay, so when you have these distinctions and you've earned these honors, what do you hope comes out of this for women, and particularly women's health?
Well, I'm really hoping that these distinctions are going to bring attention to minimally invasive surgery, especially that the option for minimally invasive surgery is out there.
Okay, so for the women who are watching this morning, maybe one of them needs a hysterectomy. Maybe they've been told they need a hysterectomy, but their doctor is going to do it. I mean, this is an invasive surgery. Are you saying there's an option to have a minimally invasive hysterectomy?
Absolutely. I'm saying a lot of women that are offered a hysterectomy might be offered it, by the same physician they've had their whole lives. He may not be comfortable performing a minimally invasive procedure, and they just may not realize that this could be done either with tiny incisions through the belly button or possibly no incisions at all, and otherwise may not know that option exists, and maybe thinking about just being cut open.
Yeah, and we talked about this in the first segment, but ladies get comfortable, right?
Absolutely.
We get comfortable with our doctor. We don't think to ask those questions, but you said don't be afraid. And are there specific questions that we should ask them?
Yeah, I would ask if the procedure you're proposing could be performed through minimally invasive means.
Okay, and if they say no, what's the next step?
Well, it's never a bad idea to get a second opinion, but not every surgery can be done through minimally invasive means.
Right, but hysterectomies, that's huge, because and that's the scar that we saw in the first piece. That's the old way of doing it, and you're saying no, there's a lot of new advances. Do you consistently find yourself on the cutting edge?
I try to stay on the cutting edge of research, yes.
All right, well, congratulations on that Guinness World Record and all of your other distinctions. It's great having you on Sonoran Living.
Thank
we
you very
appreciate
much.
that. If you'd like to learn more about Dr. Greg Marchand's minimally invasive surgeries, he has a website, and he can also come out and do some speaking engagements for you as well. We've posted that link on sonoranliving.com, and it's gregmarchandmd.com. gregmarchandmd.com.